This is my friend Emma. Both of our kids both have cerebral palsy. If you guys don't know what that is, we're going to be talking more about disabilities and needs. We met 4.5 years ago?
Through therapy, where both of our sons go for therapy.
Yeah. So we've made that bond, and it's really crazy when you think about it, because people, whenever you meet people and they are introduced to your kids that have needs, they kind of just stand and stare, and what's wrong, and is there something that I need to ask? Did you do something wrong? I've gotten that question a lot. I don't know about Emma, but I got approached by a gentleman, and he goes, "How much meth did you do for your child to be like that?" And I go, in my brain, in that nice little brain, I wanted to say, "How many times did your mother drop you on your head to be that stupid?" But I didn't say that. And you get asked these certain questions and why your children are like this, and sometimes you just gotta say, well, God made him that way, and he's just proving how strong I am going to be as a person. And that is just fine. I don't know about you. What's your experience with that?
A lot of the time I have kids ask questions, and that's my favorite questions to answer because they're so innocent, and a lot of the questions are regarding, so Liam's nonverbal, and he's in a wheelchair, so he doesn't really walk on his own, and he also has a feeding tube, so he gets to enjoy food through his mouth just for good taste, and then we can put all the greens in through the tube. So, but a lot of the questions are from kids, what the tube is, and why, and even his own brother, because he has a 5-year-old little brother. And so kids have the most innocent questions, and I guess I enjoy answering those. But it's also a learning experience answering questions for kids and adults, because I'm never sure exactly how to answer them. Like with adults, I can be more scientific. I can say, here's his disability, and here's what happened, and here's what we do to accommodate him in different situations. And then with kids, I have to do it a little bit differently. So I haven't had too many negative comments or questions. So I'm pretty lucky in that, in that aspect. And I'm a little bit like, Carson's 5, Liam's 8, and then my son is 5. So Kady's just a little bit behind, and I'm excited in watching her journey, because when Cohen's born, it's going to be absolutely amazing, because one of the best things we did was have a sibling for Liam. And little kids being so innocent, they don't notice that the other kids are different. Oliver, my 5-year-old, he doesn't notice. I mean, he notices that his brother is in a wheelchair and that he communicates differently, and the same with Carson, but he doesn't treat them any differently. And I think that is one of the main points that Kady and I want to touch on, is how to approach someone with a disability. Don't have fear, and treat them like you would anybody else. And actually ramble on just a little bit more. I'll tell you. One maybe hard, not necessarily negative experience that I have is my son's 8, and he's been around my whole family, for all those 8 years, but it still pains me in my heart, because I have some family members that will come over and visit, and because it's so easy to talk to my 5-year-old, because he's verbal and typical, I think sometimes Liam gets left to the side, and I have to remind certain family members hours. When you come to my house, please stop and say hi to Liam, because he may not speak to you with words, but he knows everything that's going on. And so I say, if I lost the ability to talk tomorrow, would you walk past me and talk with everyone else while I had to watch you do this? And they say no. I said, then remember, and also teach your kids that Liam is different, but the same. So,
different doesn't have to be bad.
no, we just have to learn how to communicate differently. And I think with a lot of people, I don't get angry because I think it stems from fear or the unknown. Because if you see a child or an adult and maybe they're in a wheelchair and our kids make noise, when they're happy, they'll let you know, they're, I'm excited, or hey, this isn't a good thing. And so,
Or pain.
yes. And so I think kids and adults alike are afraid to approach. And I think that's where it goes.
Oh,
into
you're good.
argument. Sorry.
I was going to discuss that. We actually had a conversation with one of our therapists that we have a mutual therapist with, and she was talking to me about this girl that she's had since she was 9 months old, and she's 22 now, and she was in a store, and these girls who were shopping in the same, you're going shop. Us ladies kind of get, if you're like have a little shopping bug, you like going shopping, you like looking at things, and if you see somebody looking at the same outfit, you're like, I'm cool, or this looks really nice. Well, instead of them being like, oh, that'll look pretty on you, they just kind of were like, and walked away from her. Didn't even acknowledge that she was a human being, just that she was in a chair, and they didn't consider her a person. They just thought you're a decoration. And I notice that sometimes, I haven't got that at the church, but I've had that before in the community, that you almost look at people who are in wheelchairs or have needs or other disabilities like they are statues. And you just walk past and you don't acknowledge them. And even if you just do a smile or how's your day, or if they have a caregiver with them, or a mom or a dad or someone caring for them, if they have somebody, don't talk to the caregiver, don't talk to the parent, talk to them, because most of the time we get asked the questions and we answer for them, and that's just what we do, right? But you actually want to know about them. So if you look at them, so if you, for example, let's say with Liam, hey Liam, how's your day? I get a smile or a noise or some acknowledgement that we had a conversation. Then turn to mom, how was Liam's day today? Because then you're making that interaction and you're knowing I accept, or they're knowing they are accepted. And that's all it takes for sometimes, is just that acceptance and that involvement and communication with them. Because our kids communicate with, they're called eye gazes. And they're screens, very expensive screens. They're about $25,000 a piece. We are very nervous when we give them to people at school because they have been dropped by, my therapist dropped mine once. And what it does is it has 2 cameras in it and they sync to each one of your eyes so that you can say sentences. And so Carson is really smart. He's never used it here at church, but Carson can actually make like 16 sentences. And he can have a conversation. He can talk to you about what he wants to eat, what games he wants to play, what activities he wants to do, or he will say, all done. And then he will put his head down and not want to talk anymore. He's a teenager trapped in a 5-year-old's body.
It's really cool.
So, did you guys know, Emma brought up this thing, and I didn't even put 2 and 2 together. Did you know that many families who have children with special needs don't attend church? Do you notice that? or not a lot of people with needs attend church. A lot of the times in churches, there's not adequate seating for them. And Pastor Blaine, I actually asked him, I don't know if you guys noticed the back row in our church. It's been changed for a while now, but there's 2 separate pews and there's sections in between so that we can have wheelchairs in our church. And before that wasn't a possibility, we had to sit in the foyer. Or I had to lift him up, and some of you guys saw me fall down the stairs with Carson. But I had to lift him up and I had to take him in there. So we like that we're feeling included. Our families are included and our kids are included.
And also the differences, for me, like I said, Liam likes to be loud. And so when he's really excited, he might yell. And I was always worried that he's going to interrupt. Or I've heard some families saying, hey, they've been told, can you not bring your kid to church because they're too loud? And so when I spoke to Kady, she said, well, you guys are welcome here. That made me feel good. and our family's just been sick or busy or on a trip, but we plan on coming very soon on a Sunday.
And when we say trip,
Yeah.
it's not really a trip. We went to Seattle Children's for a couple of days to get tests done. Everybody thinks we go on trips.
That's every 3 months.
Yeah, every 3 months to 6 months. We are in Seattle. We have pretty much the same doctors. So we're going to try to schedule our appointments together. And we want to point out, we are not professionals in this topic, but we live it every single day. We talk to people, and if you guys ever want to ask us questions about our kids, we are open books whenever it comes to that. Because you would think a lot of people every day, I'm going to say everyday people. I use air quotes whenever I don't like the way things are stated, but I don't know how else to put them. But your everyday people, they might say, oh, how is he like this? And how is it? You can ask me that. I'm not going to be offended. They're never going to offend me on how you're asking me a question. Or Emma, you'll never with her. But I may say, hey, this is how we would word it in our community. And if you're talking to somebody else who has a disability, they might want it this way. Like we were talking to some of our friends. They don't like using the word special needs. We are fine with that.
Why is that?
What was your...
One mother said that she feels that her kids don't have special needs, that we all have needs that are special, so she doesn't want them singled out saying special needs. So she likes using disability, the word disabilities. And then some parents don't like using the word disability. And so it's just a personal, but I think anything that makes the kid or the parent feel like they're being, maybe it makes them feel ostracized. I'm not sure. But we've always used special needs. Yeah.
And then whenever we talk about our kids with CP, we call them warriors. Because they have that invisible layer of armor. Because they're always going to have to go through a fight. Just like us as Christians, you have to do a fight. That you're a Christian sometimes. Because other people don't accept you for your religion. While other people don't accept him for his disability. So he is a warrior, he is a fighter, he is my inspiration, he is my heart, and I'm his soldier. He's my leading man in my life, so I wouldn't be who I am without him. Yeah. So again, going back to showing interest in children who have disabilities, try to get to know the child on their level. Whenever you have a little child, think about it. Would you like if somebody talked down to you? I mean, I can do it to Emma all the time, but would you like that? Would you like to be talked down to? I like to get on the level of children. And so with our children being in wheelchairs for their age, it's pretty cool because they're actually up here. So it's really nice especially right now, it's really nice being on the same level and having that communication. And so get on the level of a child. Pull a chair up next to them and just talk. You may not get a response. That is okay. He doesn't hate you. He may not fully know you, and so he might be a little nervous. But, I mean, my friends know if you open up to Carson and have a conversation with him, he'll go, hi. And it's the sweetest little thing, because then you know, I'm having a conversation with you. And you accept me. And so the fact that you're being accepted, he's knowing he's being accepted.
Is it okay to touch?
Ask. It's one of those things. Ask us, especially during sick season, I would say. It's kind of like, we don't like seeing our kids are like babies, but whenever it comes to medically fragile, you kind of have to put them in the same bubble almost. Because how many people come to the church and they're coughing and sneezing, and then they come up, I want to hug your baby, when they got this brand new baby, right? And you're like, ugh. You almost want to pull the stranger danger card, but I know you.
But asking.
But ask.
Yeah, because, like, for instance, Liam is visually impaired as well. And so a lot of his enjoyments are touch. He cuddles. He's super cuddler. So music, sound, do lights, and of course, and touch too. So a lot of the kids have sensory things, so they can be startled easy. So best thing to do is to ask. Say, does Liam need a hand held today, or does Liam need a hug? Or
Is everybody hearing okay?
can Liam give a hug because he's a good hugger?
Gotta get in there. Do you wanna say what Liam's diagnoses are?
Oh, his main is he has cerebral palsy and he has epilepsy. His seizures are controlled, so that's really good. He has cortical visual impairment, so his eyes work fine, but the visual area of his brain was injured at birth, so his brain doesn't always send the right images to his eyes, so we don't always know how much he can see. And those are his main. He's would be considered a quadriplegic also. He's left side dominant, so he does a lot of batting with his hand, and we have something called a kid walk, and so that stands him up and there's wheels on the side. And he likes to party to music, so anything vestibular, bouncing, moving, he just loves that. So when you put him in kid walk and you put his favorite songs on, I always say he stabilizes with his right side and then he parties with his left. So he'll just be partying along to that music. And I think part of our speech is talking about how our kids express themselves differently since they don't use typical words or sentences. And in class, at school, Liam's in 2nd grade, he has a harness that he can wear, and then a pretty much bungee comes down from the ceiling and hooks the harness, so he can just bounce, party to his music in that. But he loves it, so he will tell you he loves it by yelling very loudly and laughing. So his teacher has to put a note on the door that says, these are good sounds, don't worry, because people walking by go, oh my, what's going on in that classroom? So there's a big note that says, these are good sounds. And
Yeah, and then Carson pretty much has the same diagnosis. He has a brain injury called periventricular leukomalacia, Jeopardy word, and then Charcot-Marie tooth, which is a muscular disease that you guys know Nancy and Tim, my husband. They both have that. So if you ever see them wearing braces, that's what. Well, Nancy wears hers all the time. Tim's a little stubborn. He's getting better though. And then cortical vision impairment as well. And then he's a mixed spastic quadriplegic cerebral palsy with dystonia. He's got hip dysplasia, global delay, and twinless twin. Some of you may know, some of you may not know that Carson was actually a twin at birth. I had them at 26 weeks, 6 days. And his brother Colton passed away at 12 days old. So it is a blessing to have another one. But me and Emma, we started talking, and when our kids were born, they actually had the same kind of situation, because her son has a brain injury from blood loss. Correct? Yeah. And Carson has a brain injury from blood loss, because whenever he was actually in the womb and they went over and were doing ultrasounds on his brain was actually fully functioning. There was nothing wrong. And then day of birth, Tim went to go take a picture of Colton, got all those pictures, and because he was the twin that was, he was having issues, to say the least. And then they went over to Carson, and he goes, I need to get pictures for Mom, because I was passed out. They gave me an Ambien the night before, and I was asleep. And went over, and they call these things turkey bags for babies, but they're like those metallic emergency blankets that you can get. And they had that over him, and they pull it off, and he's sitting in 33% of his blood because they did not clamp his cord correctly. And a month later, they checked his brain, and he was a quadriplegic. We tried doing everything possible to say it was their fault. They fought us and said, no, he's premature. You can't prove that. So I was in the realm of, in my journey, they told me at 14, 15 weeks that they couldn't see the boys' nose bone. And so that both of my children will have Downs and I need to give up. I was told to abort my children, and so I already had it in my mind that I would have special needs children. Me being me, I said, when are we gonna do Special Olympics? How old do you gotta be? Let's do this. I love sports. And the lady, whenever she told me, she goes, no, I'm serious. I think you need to abort them. And Tim and I went into that office and we bawled. And we both looked at each other and we said, how good are their hearts? And the doctor said, well, they're amazing. Well, then God is amazing, and if they have a heartbeat, then God wants them here. And that's what I want with my kids. And that's what we will do. And they were born, and they both had nose bones, and cute as can be, identical twin boys. And the funny thing is they told me the same thing about Cohen, that they can't find his nose bone. And then I showed her a picture of Carson. Oh, he looks just like Carson. So we're not worried.
Yeah.
Let's see. Another thing that we shared with each other just recently is that when we were both in the NICU, you get kind of bored, especially when you're there for a while. But you think of the regular nursery rhymes that you sing to babies and everything. We didn't have a regular nursery rhyme. Yeah, and so we were talking about what we were going to say here today, and that, well, what did you sing to Liam in the NICU? And we're sitting there eating a waffle, thanks to Lori, and we're eating a waffle, and we both sang Lean on Me. And then we started looking at what those lyrics were, and I'll let you go over that if you don't mind.
Yeah, the lyric.
Yeah.
So, sorry. wanted to say something actually first. Kady was saying that the boys are warriors, and they are. And for Kady and I both, these were our first pregnancies. And we both had a birth plan, had everything set and ready. And similar to Kady, my Liam wasn't early, he was 38 weeks, but I didn't feel him move one day in my tummy. So I went in, and 10 minutes later, they pretty much had cut him out of me and rushed him past me, and we made a glance as he was being taken away. White as a sheet, because he only had 10% of his blood left in his body, and the rest went into me. Sorry, it's important to say how my son survived. And just like her, both of us were being sewn back up, and our husbands were making sure our babies were okay. Our kids are such warriors to have survived and being so strong every day. But with something like that happening with your first child, it's very scary to try again. Because you never, when you're pregnant, think something like that would ever happen to you. So it was hard for me to make that choice to have a sibling for my son, and I did. And it was the best thing ever. And she's a warrior right now with what she's going through, because every day she smiles for her family, but inside she's scared. So I tell you, you're a warrior, Kady. And so we want to be there for our kids, or anybody, any of you. We want to say that we accept you all, and we see you, and we love you all in your individual qualities. And sometimes in our lives, we all have pain and we all have sorrow. But if we are wise, we know that there's always tomorrow. I welcome you to lean on me. And that's what we say to our boys, lean on me when you're not strong. And I'll be your friend, and I'll help you carry on. For it won't be long till I'm going to need somebody to lean on. And I think that means so much to Kady and I, because we lean on our kids. Our sons, they're our everything. I don't even know. You've finished. I'm sorry. I'm back here bawling.
She got me going. I don't know about you guys.
This
But
is strength, right?
but I was thankful whenever Mike said that it would be a really good topic for us to talk about with you guys, that accepting children, people with disabilities, because we think we're going through a hard day, and we think that our lives are tough, and we don't know how to carry on. But you always have that person to lean on. You always have somebody to lean on, and never give up on yourself.
Would it be okay if anybody had any questions?
Yeah, you can go ahead. Thank you.
Good job, guys.
Anybody have a question?
I have a comment.
Yeah.
I think it's wonderful that you two have found each other.
Yes.
And you can lean on each other.
Yeah.
That's God.
It is.
I am so blessed that I have found her, because I've been able to ask her so many. Oh, I'll repeat what she said. She said that she's glad that me and Emma found each other, and we can lean on each other, that we have that bond. I'm blessed to know you. I am honored that she calls me her friend. At this point in life, I feel like she's a sister because we literally can say, have you been through this? Have you been through this? Every surgery that Carson is expected to have, her son has been through. And you can ask a doctor and say, oh, well, how was this surgery with this person and this surgery with this person? I have a catalog that I can talk to and I can cry and she can talk back to me and I can say what my concerns are and my worries and she can tell me that I am not dumb and that this is valid. And she tells me that all the time, that you're valid for feeling like this. You're valid for feeling like this.
Yeah.
You have a comment on that?
Yeah, I just call her and complain or cry, and so it's great.
We do it a lot.
And I think just maybe one last thing is we talk about our sons. Yeah, we always want to remember if any of us or any of you have been a caregiver in your life, you know, it's hard. It could have been for a brother or sister, a friend, parent or grandparent, and you got to give, it takes a lot, but you love them and you do everything you can. So I also wanted to touch on if you have a friend or family member that is a caregiver for someone with a disability or not, it just needs, you know, help. Please give your friend grace. Parents of kids with special needs often experience limits on their time and their resources. And this may mean that they're not as available for social get-togethers or other activities as they once were. If they miss a birthday party or other family function, it doesn't mean they don't care. It may just mean that they've reached the end of their energy or are just not able to get out. So there are countless times that I've been invited to go somewhere and I want to so badly because I'm very lonely at home with nursery rhymes all day long. So adult interaction is nice, but sometimes it's just a little bit harder to get out when you're carrying your 50-pound kid to the car and his 75-pound wheelchair and his brother is throwing a tantrum and at some point someone's going to poop their pants. And so give yourself, give your friends and your loved ones grace and don't ever stop inviting people places, if that makes sense.
All right, thank you.